There are several factors that can lead to a woman needing a hysterectomy. The most common are problems with bleeding. Those are usually related to structural abnormalities, such as fibroid tumors, sometimes uterine polyps, and structural abnormalities, disease known as adenomyosis. All these conditions lead to women bleeding heavier. Sometimes they lead to pain, and sometimes they lead to increased problems with cramping. Some of these problems can be treated with medical therapy, and when that's not successful, then we talk with patients about surgical therapy, which is often hysterectomy. Hysterectomy is removal of the uterus and the cervix. Historically, hysterectomy started out with abdominal hysterectomy, where a large incision was made at the abdomen and the uterus and cervix were removed through the abdomen. As time progressed and antibiotics developed, then vaginal hysterectomy became more prominent, which allowed us to avoid a big abdominal incision. The problem is that some of these surgical problems can be very difficult to manage from a vaginal approach. So many patients still had to have abdominal hysterectomy. In the last 20 years, with the advent of the laparoscope was used to put small holes in the abdomen and with specialized surgical instruments which allowed doctors to do the upper part of the surgery from above laparoscopically and then go below and remove the uterus from the vagina and finish the surgery in a vaginal approach. So it was a combined procedure. In the last 6-7 years, the Da Vinci robot was developed, which allows people to have a robotically assisted laparoscopic hysterectomy. The robot allows us to use specialized laparoscopic tools and attach those tools to the robotic arms, and the surgeon can then go sit in a console and do the surgery with the robotic arms. The robot doesn't actually do any surgery. The surgeon has to do all of the surgery. There's training that doctors have to go through, and doctors in residency training now are trained to use robots because that is pretty much going to be a major surgical procedure of the future. The advantage of the robotic surgery over laparoscopic surgery is several things. One is the visualization. The camera that we use with the robot is actually 2 cameras that are going through one robotic port through the abdomen. We make usually 4 incisions in the abdomen to do robotic surgery, the largest being about 1 centimeter, which is less than ½ an inch. The smaller ones are only 5 millimeters or ½ a centimeter, so really less than 1/4 of an inch. The instruments that we put through are first the camera, which is 2 cameras, which gives us 3-dimensional vision. When we do regular laparoscopic surgery, we look up at a TV screen and we see just like anybody would see on a TV. When you look through the laparoscope, you see 3-dimensionally like you would see on a 3D movie, only a lot better. So now we get to see 3-dimensionally, which means I know where something is in space. I can operate behind it, beside it, or in front of it because I can see it. That's really hard to do on a TV screen. It can be done, but you're seeing 2-dimensionally, so it's very difficult. I can see it with my eye that far away from what I want to operate on. And the thing I think that most robotic surgeons like about the instrumentation is when we use laparoscopic instruments from our old surgery, they're what we call straight sticks. So you have these straight sticks that you stick in the abdomen and you have to move that wherever you want to operate. With the Da Vinci instruments, those laparoscopic instruments are not straight sticks. It's a straight stick down to the part where the instrument operates, whether it's scissors or forceps, but they move like your hand. So we're able to put instruments down with vision that far away and operate just like we have hands inside the abdomen through small incisions. Then we do the hysterectomy completely from above, we remove the uterus from below, and then because we have this mobility, we sew the vagina up internally. Now some patients have a supracervical hysterectomy where they leave the cervix in and remove the top part of the uterus. Of course the ovaries can be removed, and there are multiple other surgeries that can be done.